First, live, local. This is Fox 12 Now.
Yeah, this is Fox 12 Now, and again, I'm Greg Nibbler, live here in the Fox 12 Oregon newsroom. I switched gears here with this map. We're taking a look at just some of the air quality index ratings from around the Northwest. The western side is starting to clear off a little bit, and not too bad of air quality, but when you look over here, you see it's just terrible. And so some of these spots especially up in northern Washington right now, but also around these fires in Oregon as well, so it can get really bad. When it comes to wildfires, whether it's the smoke, whether it's the fire itself, the damage that it causes in so many different ways, or just the stress of even knowing that they're going on, it's affecting pretty much everybody here in the Northwest in some way, shape, or form. And that can also affect your mental health. We spoke to an expert about that, about things that you can do to just alleviate things that are happening now, but also prepare for things happening ahead of time to make sure that you're in the right state of mind when those things take place. Here we go.
Certainly here in Oregon and in many other states, we've been facing wildfires on a more consistent basis, more common. They last longer throughout the year, and the smoke can certainly dissipate, reach communities that aren't directly impacted by the fire. So, these are things we faced before, and what we know is it can create anxiety and stress as we worry about our own health. We worry about the health of our loved ones, the people in our household. We worry about relatives and friends who may be far away from us, but in the path of a wildfire or being affected by smoke. And so all those things can lead to more stress and anxiety, and even cause us to have physical ailments like reduced or increased susceptibility to infection. So we're more likely to get sick while we're stressed. And so we can do things to plan and to address this stress and make us all feel better.
Yeah, how do you go about, knowing that wildfire season is going to happen? Most likely if you're in the Northwest, you're going to encounter smoke at the very minimum. So what are some steps that you can do to try to plan ahead for your mental health?
So I would say, preparedness is a really important thing. So when we're not facing the crisis of a wildfire, or we're not worried about having to deal with the smoke from a wildfire, think about where you are, where your loved ones are, make a plan to evacuate if you need to, gather in medicines, important papers, and other things in a place that you can grab them and go fairly quickly with your loved ones, including your pets and animals. Have a plan for if you're in an area that may be impacted by wildfire smoke, which is most of us at one time or another, is how can you keep the air in your house cleaner? Do you have air conditioning that you can recirculate and keep windows closed? Are there other air filtration systems that you can have so that you can plan for those? So taking some actions when we're not in the crisis is really helpful, because then that means we can take steps to protect ourselves and do things, active things that are helping us and helping our loved ones. During the time when we're faced with being in the path of a wildfire, again, pulling out that plan, preparing for evacuations, checking on friends and loved ones in the area, seeing how they're doing, if they need any assistance as well, and talking to people about how they're feeling, particularly people who've been impacted in the past, who may have evacuated in the past or been directly impacted by a fire. This can bring up all those emotions that we felt a year ago or several years ago. So talk about them, share your feelings. And if you're the person interacting with someone who is experiencing that stress, listen. Be that person that they can talk to in a non-judgmental way about how they're feeling, and just offer the support that you can to them. There are also resources that we can lean on if we're feeling more stress or more anxiety than we can do from talking to our friends and loved ones, such as the 988 Suicide and Crisis Line and the Lines for Life line, which is 800-923-HELP, which can provide help for individuals facing stressful situations.
Does there tend to be a higher level of mental health concerns and issues that come up here in the Northwest because of how many wildfires we have?
I think what we know is that facing these situations of wildfires, potential evacuations, and the smoke and the changes in our life that we have to do because of exposure to smoke certainly do increase stress and anxiety. It's hard to put an actual number on how much that goes up because we do think a lot of people reach out to friends and loved ones and have friends and loved ones that reach out to them to try and support them through that piece. And I think, this these experiences serve as a reminder to be there for folks, to reach out to folks who may need us, and hopefully we have folks who are reaching out to us as we need them. But then, if we get beyond the level of support that we can get from friends and family, reaching out for professional help is certainly something we can do. But it's hard to quantify the exact impact of smoke and wildfires on those calls.
Are there signs and things that you can notice in, family, friends, whoever it may be, where maybe they are experiencing some of the anxiety or stress and they don't even realize it perhaps? Are there any kind of tells or symptoms or things that you can notice?
Well, I think different people manifest those feelings in different ways. So I'll start with children. Some children shut down. They are less interactive. Maybe their personality changes. They are usually a very happy and talkative child, and they stop talking. Some children may kind of be more angry and reactive. And so it's important to have an adult in their life that can just sit down and say, how are you feeling? This is tough. I understand that. Tell me what you're feeling, and listen to them and try and support them through that. Adults in the same way can handle things differently, and again, may kind of shut down and not be their normal self. Maybe anxious and fidgety and more active. And again, it's the same thing. Ask folks how they're feeling. Is there anything I can do to help you? And listen to what they're experiencing and be there for them. And hopefully, if you're the person in that situation, someone is doing the same for you.
Yeah, yeah. Anything else that you think is important for people to know or just to be thinking about during this time?
I think it's important that, we're going to continue to face this increased danger from wildfires during longer periods throughout the year. They're going to be unpredictable at times. And so having some baseline level of preparedness for yourself and your loved ones, for those around you, knowing where your important papers are, what you might need in terms of medication and other things if you have to evacuate. So having that plan to take some active steps. Sharing, appropriate contact information or meetup locations with family and friends in case you're separated during an emergency. And then having plans for how we deal with the longer term impacts of smoke and poor air quality that can linger over large parts of our state, even following the immediate crisis of a wildfire, are important. That's especially important for younger children, for older adults, and those with some chronic conditions such as lung disease or heart disease that may be more impacted by the smoke and may need to find safe indoor places. That safe indoor place from the smoke is not your home. Make plans with friends and family for somewhere you can go, or find a drop-in center that has, better air quality than you do at home, so that you can stay healthy, take care of yourself, and be there for your loved ones.